How does CSF help diagnose MS with a lumbar puncture? Imagine peering inside the body to find clues that reveal what's happening in the nervous system. That's exactly what a lumbar puncture does when diagnosing multiple sclerosis. It involves inserting a thin needle into the lower back to collect cerebrospinal fluid, the clear liquid that surrounds the brain and spinal cord. This fluid acts like a window into the central nervous system, giving doctors vital information. In multiple sclerosis, the immune system mistakenly attacks the protective covering of nerve fibers called myelin. This leads to inflammation and nerve damage. These immune activities change the composition of the cerebrospinal fluid. By analyzing it, doctors can find signs that support a misdiagnosis. One of the most important markers in cerebrospinal fluid is the presence of oligoclonal bands. These are specific proteins produced by immune cells within the central nervous system. When oligoclonal bands are found in the cerebrospinal fluid but not in the blood, it suggests that there is localized immune activity happening in the brain or spinal cord, which is common in MS. Detecting these bands is considered a key test and is often called the gold standard for supporting a misdiagnosis. However, it's important to remember that about 5 to 10% of people with MS may not have these bands, and oligoclonal bands can sometimes appear in other neurological conditions, so they are not a standalone proof. Besides oligoclonal bands, the cerebrospinal fluid of someone with MS often shows increased levels of immune-related proteins, especially immunoglobulin G. Elevated immunoglobulin G indicates ongoing immune activity within the central nervous system, which aligns with the inflammation seen in MS. More recently, measuring free light chains, particularly kappa-free light chains, in cerebrospinal fluid has gained attention. Elevated levels of these proteins can also reflect immune system activation related to MS and may help improve diagnostic accuracy when used alongside traditional tests. The analysis also looks at cell counts and other parameters. Typically, cerebrospinal fluid in MS patients has a normal or only mildly elevated number of white blood cells, usually fewer than 20 mononuclear cells. The opening pressure during the lumbar puncture is also generally normal. These findings help distinguish MS from infections or other neurological diseases that might cause more significant changes. It's important to emphasize that cerebrospinal fluid analysis is just one piece of the puzzle. Doctors combine these findings with clinical symptoms, magnetic resonance imaging scans, and other tests to arrive at a diagnosis. The lumbar puncture is especially useful when MRI results are inconclusive or when confirming progressive MS, where a definitive diagnosis is crucial for starting appropriate treatment. In summary, cerebrospinal fluid collected through a lumbar puncture provides critical clues about immune activity in the central nervous system. The presence of oligoclonal bands, elevated immunoglobulin G, and other immune markers help support a MS diagnosis. But because no single test can confirm MS alone, these results are always interpreted alongside clinical and imaging findings. If you or someone you know is undergoing diagnosis for MS, it's essential to consult healthcare professionals who can evaluate all the evidence and guide the next steps.